And welcome, ladies and gentlemen. Welcome back again to another installment of the Healthcare Business Network, where business and healthcare are our business. And I want to welcome you again to another installment in our show. This is Ron Nyman. Again, you can get all our shows at hbnradioshow.com. That's hbnradioshow.com. And this week, we have another guest on an interesting business topic in the world of healthcare. His name is Dr. Brian Hines. Dr. Hines is a urogynecologist. He is the director of the urogynecology and pelvic surgery practice located in Stamford, Connecticut. He is the director of urogynecology and pelvic reconstructive surgery at the Stamford Hospital. And he's also assistant professor of obstetrics and gynecology at Columbia University College of Physicians and Surgeons. Dr. Hines received his fellowship in urogynecology and reconstructive pelvic surgery at the New York University School of Medicine, and he did his residency at the Mount Sinai Medical Center in New York. He earned his medical degree from Boston University. He received his undergraduate degree at MIT, the Massachusetts Institute of Technology, which means he is a very smart guy. He has written numerous publications and lectured on different medical issues throughout the United States. It is a great honor to have Dr. Hines with us this evening, and we're going to be speaking with Dr. Hines about his newest venture, which he has both founded and is the leader of. It is called Doctors Aiding Doctors. My great pleasure in welcoming Dr. Hines to our show. Welcome, Dr. Hines.
Thank you very much for that generous introduction. It's a pleasure to speak with you, Ron.
Well, it is our pleasure to have you here at the Healthcare Business Network. So, Dr. Hines, how did you come up with this idea or concept for Doctors Aiding Doctors?
Doctors Aiding Doctors is a group of specialist physicians that come together with the goal of helping primary care doctors. And the way that we intend on helping primary care doctors is basically to help them make their practices more lucrative. We want to increase the reimbursement that primary care doctors are getting. And basically the way that this all kind of started was just by listening to two different groups of people. And those two different groups of people were my patients and my colleagues. You know, I'd see patients for years. You know, as you said in the introduction, my practice is a urogynecology practice. So I take care of women that have pelvic floor problems, specifically avoiding problems. They have urinary incontinence. They have overactive bladder. And the typical patient that I see is a woman that comes in. She's been dealing with limiting what she likes to do, adjusting her activities, compromising her quality of life for years, kind of suffering silently with urinary incontinence because nobody ever asked her about it, and she didn't understand there was anything that she could do about it. And she'd been all along going every year for, regular visits, checkups, physicals with her internist. She'd been going to her gynecologist, getting regular exams, and yet nobody asked her about something that was, so dramatically affecting her quality of life. So you had this one group of people who were suffering with this problem that's treatable, but suffering silently with it, doing nothing. And then the other group of people were, my primary care colleagues, my OBGYN colleagues, who you sit around at different medical staff meetings with, and they're constantly complaining about, poor reimbursement, working longer hours, poor job satisfaction, doing the same thing, all day, every day. Primary care doctors talking about that their average visits are reimbursed $70 a visit. And it sort of just occurred to me one day, well, if we could get these, two groups of people together, just within the context of what I do, evaluating women who have incontinence, if we could train the internists, if we could train the OBGYNs to do some of the basic, evaluation type techniques that we do in our practice that are compensated at a scale of about 10 to 1 for what primary care doctors typically get for an office visit, the patients would be receiving the right care at the right time. The doctors would be exposed to certain diagnostic tests, certain conservative type treatments in their practice that could help their practice increase their bottom line, increase their revenue, literally 10 to 1. A urodynamics visit, the basic way to evaluate women with voiding dysfunction, takes about the same amount of time as the average primary care visit, but instead of being reimbursed about $70, is reimbursed typically somewhere between $600 and $700. And so it just seemed that if we could take this group of people, these patients that have this need, and we take these group of physicians that have this need, and I, or the company that I founded, Doctors Aiding Doctors, serves as this bridge in between those two different populations. We provide the education, we provide the support for the primary care doctors to learn how to integrate this testing equipment, this treatment equipment into their practice. It seems sort of like something that was needed, and could really fill a nice niche.
So what you're saying essentially is the target audience for Doctors Aiding Doctors are primary care physicians such as internists, family medicine doctors, could be your standard OBGYN doctors, and you're going to have these doctors do a lot of the testing that specialists have been doing in the past. Is that correct?
Yeah, it's interesting. My initial thought when I started this really was just that I could teach primary care doctors to do something that I do in my practice. I could teach them how to do urodynamics. I could teach them how to do pelvic floor physical therapy, and they could offer these things to their patients. And that was really sort of the initial thought, and that was the model, that we were going to, with the support of specialists, we were going to help primary care doctors appropriately expand their services to include well-compensated tests and treatments. And I started, running this idea by, a variety of different people, and what kept coming back to me was, when I spoke to different specialists about this, was, there's something in what we do that would also work great in that model. There's, we have, there's an ophthalmologist who's part of the Doctors Aiding Doctors Board who I never imagined that there were procedures or tests that would be appropriate to kind of take from what an ophthalmologist does, put them in the primary care arena, increase the revenue for primary care doctors, and give patients more appropriate and better access to screening. And the truth is that, so we started off with the concept of bringing urodynamics and pelvic floor therapy to primary care doctors, and it's really expanded, dramatically from that point, to include, appropriate diagnostic and therapeutic procedures from a variety of specialties, bringing those to primary care doctors with the specialists acting as the interface. So you're absolutely right. The target audience are, all variety of primary care doctors as well as OBGYNs.